Jordan Cook, and she's going to enlighten us on chiropractic care.
Hello everyone, I'm the last one of the day, so I'll try and get through this and get through after having lunch. Hopefully we can take a little stretch, wake up a bit, and talk about how we can get our horses to relax, perform better. So I'm Dr. Jordan Cook. I was actually an intern here many moons ago, moved back to Ontario, worked for a big practice out there, and was lucky enough to have the opportunity to come back. In the meantime, I've been certified in chiropractic, and hopefully I should be finishing my acupuncture exam soon as well. So how many of you out there have had chiropractic work done on yourself? We'll start there. Awesome, okay. What about on your horses? Excellent. Okay, so for a lot of you, this might be very familiar territory, but hopefully for the rest of you, we'll learn a lot. Chiropractic is a huge topic, so I tried to squish it down a little bit. We're going to get into a bit of detail about some anatomy stuff, just because I think that that's a really good way for us to start talking about the basics of where this is all coming from, because there's a lot of misconceptions about it. I know I had some before I started learning about it and getting some training in it, and it's not the sort of big, scary jumping on bones and cracking and popping that maybe we all thought it was at one point. So I'm going to try and give you guys a different way of looking at it and seeing how you can incorporate it into sort of the health of your horse and into your routine so that we can get a happier animal at the end of the day. So we're going to talk first of all about what is chiropractic. So when we actually break down the word chiropractic, it means practice using our hands. You'll notice a lot of what we're doing, we're using our hands and to perform sort of manual therapy on our horse. So it primarily concerns itself between the relationship in the structure. So we're looking at the anatomy of the horse, primarily the spine, but I do some adjustments on the actual lower legs themselves. But we're going to focus today a little bit on the spine itself, and then the function. So the nervous system, obviously, is closely associated with the spine and the spinal cord, and so then those nerves that come out of the spinal cord are what allow our horse's muscles to do their job, and so that is where chiropractic comes into play. And so then overall, how is that relationship between your horse's anatomy and the function of its nervous system going to allow that horse to perform at its best? So we are using manual or manipulative therapy in order to treat subluxations. So subluxation is a bit of a confusing word because the way I, talking about chiropractic, would use that word is very different from how your regular human doctor is going to talk about a subluxation. So in my world, too many buttons. There we go. There's what I'm looking for. In my world, a subluxation is a dysfunction of a segment. This is not something you're going to pick up on an x-ray. This is something that when I'm testing your horse's ranges of motion, I can tell you that an area, and I hate this word, but we talk about areas that are maybe stuck or that aren't functioning properly. So that is where subluxation is. We have generally a spinal cord segment or a spinal segment, a vertebrae, a joint that does not have proper range of motion or is not doing its job effectively. So that is where we have a subluxation. In a lot of cases, that's because we maybe have muscle spasms from an injury. We might have adhesion, scar tissue. If any of you have ever had back problems, you maybe even be able to feel on yourself that you've got knots or a big area of scar tissue, or even just looking at how you stand, you can feel that you have an old injury, maybe you lean a little bit to one side, or something just doesn't work properly. I'd be worried, do you have a subluxation in there? When we compare to if you go to a human doctor and try to say that your chiropractor said that you have a subluxation, they'd be running you to the emergency room trying to take an x-ray, because in their world, that means that we have a catastrophic injury where we have torn all the ligaments holding something together, and basically those bones are in two different rooms. So don't go and tell your doctor that, because you might end up with an emergency room visit. So we're going to kind of backtrack a little bit into way back for some of us into kind of maybe first year biology, first year anatomy classes. So the vertebral column, like I said, I'm going to focus mainly on the spine today, not so much on the lower legs, just because this is where most of my attention is going to be focused. So we've got obviously the head, we've got the cervical spine or the neck, we have our thoracic vertebrae which make up our withers, our lumbar spine or our lower back, and then we have our sacrum or our sacroiliac joint or our pelvis, and then our coccygeals. And that in us we don't really have, we consider it our tailbone, but in horses it makes up their tail. So our cervical vertebrae have two, just like us, two very unique vertebrae in that C1 and C2. They allow us to do our yes and our no motions. And then the remaining 5 cervical vertebrae are very similar in sort of shape and function and allow for a lot of that flexing and bending of the neck that we ask them to do. Our thoracic vertebrae actually make up the primary length of that spinal cord system. So they have really large, what are called dorsal spinous processes. So when we look at our horse's withers, it's not that our actual spine curves up underneath that withers, but they have really long, let's see if I can do this, dorsal spinous processes that get much longer up underneath the withers and then slowly taper down in size as we get into a back. So if we talk about different size, thoroughbreds have the big high withers versus some of our drafts have a lot more of a mutton withers. They all have different length spinous processes. And this is also where our ribs attach as well. So then our lower back is made up of our lumbar vertebrae. And the biggest difference we see with our lumbar vertebrae is so that they might have short little dorsal spines, but they have really long, what are called transverse spines. So in horses, these stick out to the sides, really long, think of it like a tree. And that's where all of that lower back muscle is supported, basically, this tiny little area right here. That's where a huge amount of pressure is placed. I mean, take a look at this ringer. That is holding a whole lot of flexion. They have to be really strong through that lower back, but they're gonna be popping out discs and having a lot of issues. Compared to in a dog, where they actually have much shorter transverse processes. And what that allows them to do is have a lot more side-to-side flexion than a horse does. So the very confusing sacroiliac joint and pelvis is actually a combination of sort of 2 major bone structures. So we have the continuation of our spinal column. So coming down, this is a view looking down on top of the horse. So these are our lumbar transverse processes, and then this is actually our spine coming down here. So what we're looking at is this is our sacrum, which is basically this up here. So all of those individual little sacrovertebrae are actually fused together into one sacrum, just like this. So then our sacroiliac joints is where our ilium, which is a piece of our pelvis, so which is this big guy right here, and from the back is this big ring structure right here. So our sacroiliac joint is right where our sacrum meets that ilium or our pelvis. So from the back, you can see our sacroiliac joint is right there. There's 2 of them, one on either side of the spinal column. But remember, on top of this, our horse actually has a huge amount of musculature over top of that joint. So if any of you have ever had your horse's sacroiliac joints injected, this is not an easy procedure to do because that joint is actually quite a number of inches below all of that musculature, deep where that sacrum joins with the pelvis. And this sacrum, or the sacroiliac joint, has a huge role, especially in all the things that we ask our horses to do, and even just in general walking. For us to walk, and for your horse to walk, we need to have really nice flexion through that sacroiliac joint. If we don't have that, we turn into kind of like a penguin peg-legging it, and our horses do the exact same. And that's where we see a lot of our problems in horses, especially with the things that we ask them to do, but then on top of that, remember, they live outside half the time. They're running, bucking, playing, God knows what, and then they've got 1,200 pounds coming down on that sacroiliac joint, so it's very easy for them to tweak it a lot more than we can. So this is kind of how it looks all put together. So I'm gonna get a little bit more technical here. So bear with me, so the vertebrae, as we said, it houses the spinal cord. as we just looked at, each of the vertebrae vary in size and shape depending on what part of that spinal column they actually make up. So it varies based on cervical vertebrae, have short processes, but big bodies to carry all of that muscle in their neck and basically hold up their head and allow them to lift and lower. Thoracic vertebrae have really short transverse processes, but that really tall dorsal process make up the withers. And then our lumbar vertebrae, short little dorsal spine, and then bigger transverse processes to hold all that lower back muscle. Why is that important? So, big scary words, don't worry about it. I'm not having a test on like scary Dr. Matt, but we're gonna look at where this comes into play. So we have the body, we have the lamina, which is kind of, think of it like the roof of the house. The walls of our house are called our pedicle, our dorsal spinous process, our transverse process. Now this is the most important part. So these are called our facet joints. So these are the joints that make up the spaces in between each of our vertebrae. Just the same as you have a knee joint, you have an ankle joint, you have a hip joint, you have joints, and multiple of them, in between each of your vertebrae. So those joints need to be able to flex and bend and rotate just the same as any other joint in your body. So we talked about those facet joints. And right below those facet joints is something called the intervertebral foramen. So we have the spinal column or the spinal cord running through that hole in between all of our vertebrae. But then nerves have to somewhere come out from that spinal cord in order to go to all of our muscles and our organs and all the other different areas of our bodies so that we can do our job. They have to come out a hole in the bones. That is called the intervertebral foramen. And so here are our facet joints in between each of our vertebrae. That little hole is our intervertebral foramen. So you'll notice that hole is right below the facet joints in our vertebrae. So where does chiropractic come in into all of this? Because I've thrown a whole lot of information at you. But we just said that all of the big major nerves to the body come out through a tiny little hole that we have a joint sitting right above. So what happens if that joint isn't moving or functioning properly? Or say we tweak it, we get a little bit of scar tissue, muscle spasms, bunch of inflammation around that area. Well, that nerve sits right below it. So all of a sudden, we're gonna have a huge impact on the function of that nerve. So any inflammation there can cause that nerve to no longer function properly. So depending on where that is in the body, this is kind of a brief representation of that major nervous system. But if you all of a sudden have one impingement on a little bit of a nerve there, that nerve may not function properly. Well, what if it's one of the major nerves that supplies some of the more major muscles in that hind limb, and you've got a little bit of inflammation there, so it's not firing properly, and say it works on your quad muscle. Well, your horse is going to have a bit of a harder time firing that quad muscle. So all of a sudden, we might have a little bit of a toe drag that we didn't have before, because that horse is going to have a harder time picking up that leg. And it can spiral out of control from there. And because then all of a sudden we're compensating. Oh, well, I'm not picking up that one as much, so I'm going to be putting a lot more weight on this side. Then all of a sudden you're going to have the muscles on this side spasming because all of a sudden they're taking more weight. Now you've got a crooked horse. So where do I come in? The chiro exam can vary a little bit from case to case. I see some horses where I show up and I have no intentions of looking at them for chiropractic, and then it turns into a chiropractic exam. I have other horses I'll get maybe as a referral, whether it's from another veterinarian in the area, it might be from a massage therapist in the area. Sometimes I'll get it because they're just looking for something else. They've injected every joint on this horse, they've seen everybody under the sun, and they still just don't have that horse performing at the level that they're looking for. So they'll come to me. So the first thing I'm going to do is take a look at your horse. I'm going to do a standing exam. Remember, I'm lucky enough that I have both a vet hat as well as a chiro hat. So I'm looking at your horse from a couple different views, but I'm going to be looking at different muscle tone, carriage, posture. Sometimes it can be something as simple as that horse is always resting one leg in one certain position. It can be that that horse is always standing a little bit underneath itself or always standing a little bit behind itself. And that can tell me a lot about posture. How are things moving? How is that horse comfortable? It's going to stand the most comfortable. it may only be comfortable to stand like this because we've got a lot of issues going on. And so it can give me some ideas on where to start working. I'm going to be touching your horse. I'm going to be looking for, where do I find pain? Where do I find discomfort? What type of ranges of motion do I have? And then I'm going to look at your horse go in a lot of cases. And so I'll start by watching a horse in hand. How is it walking? Sometimes even just those first few steps, walking it out of the cross ties, can give me a lot. How does it walk on different type of surfaces? In the arena, working on harder ground. How does it walk in a figure eight or in a tight circle compared to on a straight line? We might put it on a lunge line. I'm especially putting it through walk, trot, canter. How does it do its transitions? Can it effectively transition from a canter into a trot? Or does it kind of fall out of that canter and stumble itself down into a walk just because it has no more power left to keep going? And how's that SI moving? Is that lower back locked and it's just sort of puttering around? Or do we actually have really good suspension going on in there? In some cases, I might actually ask you to ride your horse. Some of my dressage clients, for example, they might complain to me, this horse is perfect, but our pee-off is just not what it used to be, or our side pastress isn't what it used to be. So I might have you actually get on your horse and show me what it is that they're doing so that we can get an idea on where are we having some of our difficulties, what are our muscles doing, do we see some spasms when we're doing certain movements that we don't see doing others. So, again, I am a veterinarian as well. In some cases, I have to put my veterinarian's hat back on. And I might say, you know what? Yes, love chiropractic, it does a lot. But your horse needs a little bit more than what I can give you. Or chiro is only going to get us so far, but we've got more things going on than what I'm going to be able to do right now or do today. So in some cases, I might refer you back to a regular veterinarian. Some of my chiro cases, we go, wait a minute, you know, I've been doing chiro on this horse every month for the last year. Your horse looks different today. It is lame today. And so we may not adjust it that day. We might do an actual lameness workup. And so we need to kind of make sure we're not overlooking some underlying lameness issues that can be causing all of our chiropractic issues as well. I kind of give myself, especially with kind of new horses I haven't worked with before, I give myself a 3-session rule. That if I keep coming back and I've adjusted that horse 3 times and I have not seen an improvement, that's when either I will say we need to take a step back and do a lameness workup, or I need to send you back to your regular vet and do a lameness workup because we're missing something. There's a reason the same things keep coming back time and time again and we're not making improvements because we should start to see something. So when you have an acutely lame horse, so if you have a horse that you pulled out of the stall that morning and it's hopping on 3 legs, don't call me for chiropractic. It happens. But you want to call me for being your vet, and then maybe we consider doing some chiropractic to help with some of those compensatory things that are going to be happening from limping for a while. But we need to make sure that we rule out something more serious that could be going on. So I'm going to do a lot of motion palpating. So what I'm going to do is start by put your horse's joints through their paces, basically. I'm going to be looking at not just the vertebrae, but also all the rest of your joints. What type of range of motion do we have? Can the legs extend and flex and bend the way they should? On the spine itself, I'm going to ask for those vertebrae, I'm going to ask them to flex in each direction. I'm going to ask them to try and rotate in each direction. And I'm going to say, is this functioning the way that it should? And try and isolate where our restrictions or our subluxations are. So I can find muscle spasming, I can find that there's reduced or abnormal ranges of motion, or I might find actual dysfunction. I might go, you know what, that's just something about that doesn't feel quite right. So this helps me determine where I'm actually going to adjust, because I'm not just going to get up there and start bouncing around and hope something pops back into place. I want to make sure that I'm targeting my adjustments to where it needs it, because in a lot of cases, you might hear me comment, oh, as soon as I, adjusted his sacroiliac joint, all of a sudden, parts of his back cleaned up. And what that tells me is that sometimes we'll have muscle spasms that can cause apparent subluxations or apparent changes in ranges of motion, but then as soon as you can restore normal range of motion somewhere else, all of a sudden those muscle spasms relax, and then we get normal range of motion in other parts of the body return. So, as I said, we are not pushing the bone back into place. So we're not snap, crackling, popping things. I'm not going to get up there and start jumping on your horse's back. I am doing what is called a low amplitude. So amplitude is our vertical distance that I'm going up and down. So a low amplitude, but high velocity, so very rapid thrust. That thrust is performed in a very specific location, so by palpating my bony landmarks, and it's in a very particular direction. And each horse is a little bit different. Your horse might be a bit of a smaller horse, and its sacroiliac joint, for example, might be on a slightly different angle than a big, giant warm blood. So it's not cookie cutter. I'm going to be able to have to change how I adjust based on your horse's shape and size and conformation. The goal of that thrust is to improve range of motion and function. That's Dr. Evans standing on his block, as we already saw earlier. So the actual adjustment itself creates a gap. So my adjustment is over a joint. So let's go back and talk about those facet joints. So I'll have an adjustment over top of a facet joint that's at that very specific angle. My goal is to gap that joint. And we're talking minute gapping. I'm not pushing those bones into different ends of the room. I'm creating a small gap. That gap sets off a chain reaction of different type of actions that are going to happen on the body. One of the first things that we're going to do is that if there are adhesions that have built up, because say this joint hasn't moved in a really long time, it's going to gather a little bit of dust, a bit of cobwebs, and it's going to have some adhesions, a little bit of scar tissue. We can start to break that down by getting it moving again. We stimulate a reflex arc. That's local, right in that vertebrae and in that section of the spinal cord, and it's going to all of a sudden decrease muscle spasms in that area as well. So we're going to decrease muscle spasms on one side of the spinal cord, but then what we're going to do is we're going to turn the muscle back on the other side. And what that allows us to do is all of a sudden start to get some of that symmetry back, get that horse moving a little bit more balanced. We're going to decrease pain, and this is one of, for a lot of people, the most important thing, because that horse might be bucking under saddle, that horse might be resistant to go forward, and some cases we have a combination of that range of motion isn't there, but also we get pain when we do it. So we're going to avoid doing it more and more and more. We turn on the autonomic nervous system. So after I do an adjustment, we might see some changes in our heart rate. We might see some changes in our respiratory rate. In our older guys, I have to be very conscientious of this as well. And so we might have to do lots of series of adjustments where I only do a couple little things because they're a little bit more sensitive and things turn on a little bit more than some of our younger horses. They're just a bit more sensitive. We also have an immediate reaction that goes up to the brain. So another good way to think about this, especially in our geriatrics, they always tell us you need to, as you get older, you need to do things that stimulate your mind. You need to do memory exercises. You need to put all those funny little apps on your phone and start teaching your brain to do something new every day. Me doing an adjustment simulates that exact same thing. So in some of our older horses, especially, where we can turn that brain back on just by doing something as simple as an adjustment, because every time I adjust, I get a skyrocketed signal going right up to the brain. So, and then we've talked about all the inflammation in that nerve coming out that intervertebral foramen. And now all of a sudden, we've reduced the muscle spasm, we've started to break down some adhesions, we've decreased some pain and inflammation in that area. So all of a sudden, that nerve signal transmission is starting to be restored a little bit. So, and then we talked a little bit about how we've got better range of motion, we've decreased those muscle spasms, we've turned on some of those muscles that maybe we forgot about, and all of a sudden we've got a horse that's moving a little bit more symmetrically, we've got a little bit more of a balanced gait, and so, I mean, we're talking a little bit more long term, but it makes it easier when we have a balanced gait to get proper muscle engagement and development, because we're not overloading one side over another. And then if we've been, say, overloading one side over and over and over again, then that side is going to be much more prone to getting some arthritic changes, some pain that Dr. Malik was talking about earlier. And if we can get that horse all of a sudden standing squarely or using both of its legs more evenly, we can slow that process down because that horse is now traveling more normally. So this is a giant chart that I had to learn when I was part of my course. And I always throw it up there to show you all the chain reactions that happen every time I do an adjustment. And I had to memorize that, recreate it, list it. So it has a special place in my heart. So now that we've done our adjustments and we've reduced some muscle spasm, we've turned some muscles on we forgot about, we've got better range of motion, what's going to happen next? Well, your horse is going to feel fantastic for a couple days, and then muscle memory is going to do its thing, and everything is going to go right back to the way it was, unless we do something about it. Think about a lot of you that go to the chiropractor yourselves. Often, if you say have an injury, you do a slip or a twist or you tweak yourself, you might have to go to your chiropractor twice a week for a couple weeks, and that's because of muscle memory. All those muscle spasms are going to keep causing those subluxations to happen over and over and over again until we can get them to settle down. We can get that range of motion to stay there. So horses are the exact same. So what we need to do is encourage the proper muscles to turn on, to stay turned on, and become stronger. A lot of the horses that I see are maybe older horses or horses that haven't been using their core properly. And so they have learned to hollow their back, stick their gut out, lock their back, and then shuffle themselves around and fling themselves over jumps. And they can do that really, really well up to a point. But then all of a sudden they'll reach kind of a limit. And now all of a sudden what we have to do is, I can get that SI moving again. I can get that lower spine moving again. But they've still got a beer gut. So we need to start retraining some of those muscles, get the core working better, get maybe their glutes working a little bit better, quads strengthened. So this is a really good book. I think any barn should have it in their arsenal of things. Activate Your Horse's Core. It is a phenomenal book with great pictures. It comes with like a DVD of videos. They have YouTube videos out there. And it's a really nice demonstration of good exercises that anyone can do on their horse. Belly lifts are key, and good way to kind of get your horse strengthening the right muscles. Because it's amazing how much these horses can compensate and use the wrong muscles for a really, really long time and still get the job done. So, is my horse a candidate for chiropractic? A lot of us, I know myself included, I maybe go to my chiropractor every few months, and usually by then it's bad, and I know it's going to be bad. And I walk in and I say, I'm really sorry, and usually it hurts for a little bit afterwards. I might be a little bit more tense, and I might make a few noises a little bit, got some creaking going on, because I've left it too long. What we want to do is try and rechange that thinking, is let's do things more into maintenance. So instead of cleaning up the mess afterwards, we can try and prevent some of those issues from happening in the first place. Basically anything is a candidate for chiropractic. I'll see anything from really, really subtle things. Like I said, some of my dressage clients, driving clients, they will comment just, they don't have the power they used to, they don't have the impulsion they used to. And it can be anything from something as subtle as that to, my horse has really bad back pain. My horse has kissing spines. I think my horse has kissing spines. My horse is bucking. My horse doesn't want me to put the saddle on. It's girthy. We can see performance deficits. All of a sudden they're taking a rail down, or they're just not getting their lead changes the way they used to. They might have obvious asymmetries. You might come say, my horse has a hunter's bumper. You know, he always stands kind of funny. ADR, that one is just, you know what, they're just not right. Something just isn't right about them. This winter, I've seen a lot of horses slipped and fell on the ice. And you know what, they're not lame, they just feel sore, and they need a little bit of help to get through. Sometimes we'll have lamenesses, and I say block, and I should probably say like block and or inject in that, where we've injected every joint on it, or we've blocked it everywhere and it's still not just quite right. That's where chiropractic can make a really big difference in some of these guys where, yeah, we've injected all the joints, but his hocks were sore for so long that his back got really, really sore, and now we have some subluxations and restrictions that need to be taken care of. Geriatrics love chiropractic. They're some of my favorite patients because they're so responsive. They lick and they chew and they just love it. And they're a lot of fun. And it makes a really big difference in their quality of life as well. So they may not be doing much. They might be your pasture ornaments. They might be your old schoolmasters that still pop the kids over a jump from time to time. And they do love chiropractic, and I think in a lot of ways they benefit from it more than some of any of our other horses. Some horses might be recovering from a surgery or an injury. We can help with those compensatory changes. Maybe they're on stall rest for a long time. They've been in a cast, something like that. They just need to get some range of motion back. More so in dogs, but we are starting to see some more research coming out on incontinence and reproductive problems as well. Remember, we said those nerves come out. They don't just supply muscles, they supply organs as well. So we can start to kind of turn things back on, get things talking again. As I said, we want to get this horse balanced in how they travel so we can increase duration between joint injections, get a better quality of life. And there's definitely a trend toward trying to do more holistic things and have kind of a more organic approach to some of our horses. So it's just another way we can treat the body without necessarily having to administer any medications. Vet hat again, if your horse is lame, have it checked out by a veterinarian. Because I'm happy to take care of your really lame horse, but sometimes it can be a really confusing conversation when I get called out for chiro and the horse is standing there on 3 legs. So if we are dealing with a lame horse, an accurate diagnosis is important, having a thorough exam. So that way it gives us a bit more realistic evaluation of what we can expect from treatment. So that's whether it's treatment from me, whether it's treatment doing joint injections, but we can try and put together a much better plan for your horse on where to go from here and what its expectations are for its goals in the future. So I really like working with a team approach. So whether I'm just the chiropractor and someone else is the vet and we've got a massage therapist, whatever, communication is really important. So we're all saying the same things and we're all expecting the same things and we're on the same page to get the horse as happy as he can be. Chiropractic, unfortunately, will not fix any of this. I can try, but it only goes so far. So this is where you do need to call in a vet. So this is Edgar. He is a goat who loved his chiropractic treatments and is probably one of my favorite patients I had when I was in Ontario. And yeah, he was normally up, running around, eating everything, and I would catch him when he was lying down on his mat, and he'd stay lying down and let me adjust him and would kind of lick and chew his cud and was happy as a clam. So, any questions? Yes. So, as with anything, there are some mild risks with chiropractic. So, one thing to know is if you have a lameness history on your horse, you have x-rays, your horse did have an injury, let us know. So then that way maybe we can avoid that area altogether. We can approach that area with caution, and it's then we can decide, is chiropractic the best for that area, or maybe I'll pull in some massage, shockwave, laser therapy in that area, and just do chiropractic on the rest of the horse. As I said, we turn the brain on. We turn everything on, that autonomic nervous system. So rarely, but it can happen, if you do too many adjustments, we can turn things on a little bit too much. So the most common side effect that we would see, and knock on wood, I've only had it happen once, and I had only done 3 adjustments on this horse, and that was it. But she was wired for sound, flipping over, not happy about life, did 2 trigger points and an adjustment, and she had a little bit of soft manure, diarrhea afterwards. She rolled once, and within 5 minutes was back to normal. But we can get them be a little bit colicky sometimes, and that's where knowing your horse, knowing if you've got a lot of problems in that horse, I'm not going to go and do 100 adjustments. We might do a couple trigger points and 2 adjustments. That might be all that horse gets for the day, because I have turned on too much, or if I have a really anxious horse, or I have a really painful horse. It can just be too much stimulation that we get the guts going a little bit too much. They get a little bit more anxious. We can see some soft manure or some colicky signs that are generally very, very transient. And as I said, that's the only one that I've ever had. and so I'm just very respectful of what the horse is telling me when I'm adjusting. And most horses are totally normal the next day. You get the odd horse that maybe is a little bit quiet that night, or might seem a little bit more sore the next day. Think of yourself after you get adjusted. Sometimes your muscles are a bit sore, and then after that, they're fine. So depending on what I'm feeling on the horse, I'll set up a bit of a different program for what are we gonna do that night, the next day, and in the few days that follow. I have the odd horse that maybe I'll have them give bute to that night if I'm worried that they might be a little bit uncomfortable just with what I was feeling that day. So, yes?
What portion of your work is caused by inappropriate length and breadth of saddles?
Oh, that's not a good question. I would say that it is not uncommon for me to see horses that have an ill-fitting saddle, and most owners, when I point out that certain trigger points have lit up for me, that maybe we need to reassess their saddle. And in a lot of cases, it's maybe they just got a new horse and they're using their old horse's saddle, or it's that the horse had a lot of time off and they got their saddle fit a year ago when he had the time off, and now all of a sudden he's been in work for a long time and he's developed a top line and that saddle fit has changed, or vice versa. They had that saddle fit when they were riding 6 days a week and showing every weekend, and that horse had all winter off and they just started back and he had dropped his top line and dropped his weight. So, it's sort of a catch-22 where we need to be aware of saddle fit and make sure that it fits. And some of the compensatory changes are from poor saddle fit, and I try and identify that if I can, and point them towards a proper saddle fitter to get that addressed, if I think that's a part of the component of the issue as well. So. Any other questions?
Are you regulated or trained by Acupuncture?
Excellent question. I had a slide on that. I didn't know if it was going to be too much. So there's two associations. There's the American Veterinary Association of Chiropractors, and then there is the College of Animal Chiropractors, which basically the two heads of the ACVM got in an argument, and they started their own association. So you want to look for a chiropractor that is regulated by one of those two or is certified by one of those two organizations. Both those websites do have a search for a chiropractor here kind of link on them. In order to take, so the course that I took was over 250 hours, and I had to be either a veterinarian or a chiropractor, human chiropractor, in order to take the course. I had to have reference letters in order to get into the course to prove that I was a reputable human being and would do a good job. I now actually teach the course, so I fly back to Ontario a couple times a year to help teach the next kind of incoming generation of students. And so there's only 4 in North America. There's one in Brantford, which is the one that I teach at, and it's the only one in Canada. And then there is Options for Animals, and then in Kansas, I think that one is. Then there's one more in Texas, and I think one more in Oregon maybe, and then they just opened one up in Germany a few years ago. So it's actually a very small population. There are a few kind of weekend warrior courses. Legally, that's supposed to be for, you go home and you treat your own horse, but you can't learn enough about anatomy and neurology and all of those things in 2 days. Like I said, I spent a couple months doing this very intense program. I was like being back in vet school again. And the breadth of knowledge you need to know when to adjust, where to adjust is, I would say definitely make sure you're looking for a certified chiropractor. So they should be either a veterinarian or a human chiropractor that has taken an approved course. Unfortunately, legally, anybody can do it. The government has not jumped on board yet with regulating, but we're trying really hard to kind of keep pushing for that and pushing for that as much as we can. So that's why we make sure that we're certified with these organizations to try and show that we're more organized and have a little bit of pushback. So one more. Okay. Like a Yeah, the VitaFloors. Sorry, I couldn't hear what you said there. I thought you were talking about in small animal, there's Fortiflora, and it's a gut stimulant, and so I didn't know if that's what you were saying. So the VitaFloors or the VitaFloors are really, really neat. They've just come out in the last couple years. They're basically a platform that your horse can stand on and it vibrates. The idea is that if the muscles that your horse already has, it will continue to cause them to micro-contract and improve sort of general fitness, not running fitness, but it can help continue to get that muscle to keep turning back on. So once we've started to turn on those right muscles, yes, the VitaFlora thing is a really good option. The horses seem to love it. They're happy, they stand on it, they're relaxed. And I mean, I could go into a whole another talk on other alternatives like your back on tracks, etc., but I'll save that for another day. All right, if you have any more questions, I'll be around for a little bit afterwards, but I hope you guys enjoyed.